بسم الله الرحمن الرحيم الحمد لله رب العالمين والصلاة والسلام على سيدنا محمد وعلى آله وصحبه أجمعين. اللهم علمنا ما ينفعنا وانفعنا بما علمتنا ووفقنا لما تحب وترضى. We are pleased to start this session, which is the monthly session about health awareness. After our initial success about mental health in February, we promised that we will keep this monthly, but we had to postpone the cancer awareness for unforeseen reasons. So tonight, inshallah ta'ala, we will be joined by Brother Qasim Ramadan, GP in Newport, Sister Asma Ali, obstetric and gynecology trainee, and Sister Seema Ahmed,
أهلا وسهلا.
general practitioner in Cardiff. As was the case with the previous session, it is an interactive session, so please ask as many questions as you can to the panel. Cancer awareness is probably one of the it has got a personal touch to me. I lost my mother at a very young age, at 57, for breast cancer. She was actually diagnosed at the age of 50. And I remember well when I asked her about the lump in her breast, and she said, well, it has been for a week. I said, well, there is no way that this is for a week. And then she said, probably a month. And then I said, well, it was an orange-sized lump. So I said, well, are you sure? She said, probably 6 months. So why didn't you say it? And then she said, well, I couldn't really tell you, and I'm her son, okay? I couldn't really tell you, and I was hoping that will go away. It didn't go away. And unfortunately, she lived 7 years with cancer, and she was quadriplegic and, at the end, and passed away at the age of 57. I don't really want to scare anyone by mentioning this story, because actually the brightest side of this story is when I moved to this country, and I'm a consultant radiologist. Always I look at the request for scans, and I was actually shocked reading when the GP or another colleague referring the patient for a scan, when I read that this patient has had a history of cancer of that type 10 years, 15 years ago, and then fought another cancer 10 years ago, and another cancer 3 years ago, and now they are suspecting a fourth cancer. And I was shocked. Can that happen? Well, in our background, in our culture, you don't need really to have a full cancer. Half a cancer is enough to kill someone, because we don't really pay attention for that. And unfortunately, always or most of the time, it is quite late. And we lost a brother, very dear brother, recently in this mosque for a cancer. And that is really the trick. The trick is awareness. The trick is early diagnosis. That's why we are really privileged tonight for my colleagues in here to present about 5 or 6 cancers, very important cancer, very common in male and female patients. So we decided we start with Sister Asma. Jazakallah khair. Just leave this one, yeah.
Hello, Assalamu alaikum. Assalamu alaikum. Let me introduce myself. My name is Dr. Asma Ali, and I'm one of the obstetric and gynecology doctors currently working in the Heath Hospital. And today, my main focus is really going to be about 2 female cancers, cervical cancer and endometrial cancer. And if anybody has any questions or they want to ask me something at the end, please feel free to do so. Okay. So I'm just going to go to the next slide. So the first cancer I'm going to talk about is cervical cancer. So what is cervical cancer? So cervical cancer is cancer of the cervix, and the cervix is the neck of the womb. So it's the opening to the womb itself. And it's the most common cancer in women globally. It affects all ages. It can affect young to old, but mainly is common in younger populations. And by younger, I'm talking about 45 years or less. Like all cancers, is a very high survival rate if it's detected early as well. So the earlier detection, the better the prognosis. So what's the main cause of cervical cancer? So around 92 to 95% of cervical cancers are caused by infection of the HPV virus, the human papilloma virus. And there's various different strains of it, but the majority of the different strains have different degrees of intensity in terms of causing cancer, but I'll just talk about it generally. So what are the symptoms of cervical cancer? So mainly is abnormal bleeding of any kind. So it could be bleeding after intercourse, it could be bleeding between a regular period, it could be bleeding after the menopause, it could be changes to any discharge, vaginal discharge, and what I mean by that, the colour may change or the consistency may change or it may become more offensive. So any changes. It could be discomfort during sexual intercourse, and it could actually involve pain in the lower tummy as well. Oh, pain in the lower tummy, sorry. So what can we do to lower our chances of getting cervical cancer? The most important message I want to sort of say today is the importance of participating in cervical screening. And cervical screening occurs between the ages of 25 and 64, and it happens every 5 years. And the aim of the cervical screening is to detect any small changes in the cervix. So what happens during your cervical screening? Essentially, you get a letter and you attend your GP practice, and there they'll perform an internal examination, and a small sample of cells are taken from your cervix, and then that sample then goes to the lab and is checked for the HPV virus. And if the cells are positive, then you'll get a letter back inviting you for further tests and further, further procedures. Other things that we can do to prevent cervical cancer is getting our children vaccinated between the ages of 12 and 13. If we look at the rates of cervical cancer before and after the HPV vaccine was introduced, we can see that there's a marked decline in cervical cancer once the vaccine came into play. Using protection and barrier methods as well during intercourse. Quitting smoking, so giving your body a good chance of fighting this virus, and eating a balanced diet to support your immune system. And the main message I want to get through really with regards to cervical screening is that if I look in my practice at the people who attend with cervical cancer, the majority of them generally are not from an Asian or a minority background. Majority of them are Caucasian, are white. And so it's really important for us as a community to get behind our women and invite them and actually essentially encourage people to participate in cervical screening. Okay. So the next cancer I'll be talking today is another female cancer, and this is called endometrial cancer, or womb cancer is another name for it. So womb cancer is a cancer that affects the womb itself, and it mainly starts in the lining of the womb, and the medical term for that is the endometrium. It's the most common gynecological female cancer in the UK, and like all cancers, it can occur in all ages, but the most common age is after the menopause, and mainly between the ages of 75 to 79. So what are the symptoms of endometrial cancer? Basically, like cervical cancer, is any type of abnormal bleeding, but mainly vaginal bleeding or spotting after the menopause. Heavier periods, which are unusual for you. So you might have a normal period, but then all of a sudden it becomes heavier, and that's unusual. Bleeding between a period, any change in discharge, or any lump or swelling in the lower tummy, or any pain in the lower tummy. Now, these symptoms overlap with the cervical cancer symptoms as well, and in fact they overlap with a lot of other gynecological issues as well. But if you have any concerns with any symptoms or you're worried, please seek further help and advice by going to your GP. Okay, so what are the causes of endometrial cancer? There are lots of causes of endometrial cancer, and to be honest, we don't know what the majority, we don't know all of the causes, but what we do know that is linked strongly with high levels of the female hormone estrogen. So women who are at risk are women who are overweight, women who have conditions such as polycystic ovaries, women who are taking the hormone replacement therapy, women who either start their periods early or finish their periods late. And what I mean by that, a late menopause, age 55 years and above. So you've had a longer period of your life being exposed to estrogen. And then any family history of bowel or ovarian cancers. Of course, there are other factors that can cause endometrial cancer, such as genetics, but I won't go into them today, but mainly is related to high levels of the female hormone, estrogen. So what can we do to lower our chances of getting endometrial cancer? The most important thing is maintaining a healthy weight, eating a balanced meal and doing regular exercise, stopping smoking, and speaking to your GP about certain medications that can be provided to reduce the risk of estrogen, to reduce the amount of estrogen, sorry. So if you have any concerns or any symptoms, please seek advice from your GP. The earlier these symptoms are detected, the higher the chance of recovery and survival as well. And of course, there are lots of information out there. My main information came from the NHS website, which is available in different languages, and also Macmillan Cancer Support offer lots and lots of information in various different languages as well. You can get written information, you can get oral information as well, and you can also access the website as well, macmillan.org.uk. So I appreciate this was like a whistle-top tour of these two cancers, and there's lots more information about it, and if you have any questions, please let me know. Has anybody got any questions to start with before I move on to our next speaker? Oh, we'll do it at the end. Oh, sorry. There we go. Lovely. Here we go, Simon.
Assalamu alaikum everyone. My name is Dr. Saima Ahmed. I'm a GP in Cardiff, and I'm talking to you today very quickly. My slides are a bit more busy about bowel cancer first of all. So just before I start going into this, thank you Dr. Hashim for hosting MDC today. And also we're talking about topics relating to males, females and both. We've all got mothers, sisters, daughters, husbands, brothers, sons, so what we want to try and do is encourage these conversations. These are medical problems. Nobody wants to have cancer. But what we want to do is, if somebody's worried about a certain type of cancer, whether that's testicular cancer or breast cancer or a cancer around the vaginal area, we need to normalise these topics because it's medicine. We need our communities to feel comfortable to talk about it, because if you're worried, you're going to then share those concerns, and if you're too worried, you're not going to go and speak to your GP. I want you to come to speak to us. Go and speak to your GPs, your healthcare professionals, but most of all, share your worries with your families, your friends. Maybe they can give you advice and give you that support to go and seek that medical help. So it's really important. So if you're going to take away one thing today, please take that away, that if you're worried, let's open up these conversations and normalise talking about medical problems. Okay, so I'm going to be very quickly talking about bowel cancer to start with. It affects men and women. The main symptoms that we need to think about are the ones in the middle of this slide. So you're looking for bleeding from in the stools, and that could be fresh red blood, but more specifically black tarry blood. So anything like that is just old blood. The fresh red blood is obviously blood. So any of those types of blood, I'd advise to speak to your GP. Any persistent and unexplained change in bowel habit, that means if you're always constipated and that's your normal, and that's been for years and years, and then it changes to diarrhea, or, you know, if you've had normal consistent stools and it changes in any way. So it doesn't matter how it's changed. If there's any type of change, then you need to be getting that checked. So the earlier bowel cancer is diagnosed and much easier to treat than when it's picked up later. So the other symptoms are very vague, and they can overlap with lots of different types of worrying conditions and different cancers. And these are unexplained weight loss. So you've noticed that you've been losing weight, or maybe family members or friends have noticed, oh, you've lost quite a bit of weight there, but it's not intentional. You're not dieting, you're not exercising. The one thing to say though is lots of people maybe are exercising, but they're losing that weight a little bit too quick to considering how much they're exercising or dieting. Just be aware of that. But most importantly is unexplained weight loss. Extreme tiredness for no obvious reason. Again, it can overlap with B12 deficiencies or lots of different deficiencies, but you know, extreme tiredness that's making you sleep more often, or you're feeling a lot more fatigued. Make sure you get that checked. And then slightly more obviously, we'll say this ongoing, so any severe tummy pain should be getting medical attention, but ongoing tummy pain, or if your tummy just feels a bit lumpy or abnormal for yourself, then make sure you get that checked. Lots of the risk factors that Dr. Asma talked about, they overlap with most of the cancers. So essentially smoking, overweight, obesity, and I know I think we'll be repeating this, hopefully just to get that knowledge across. Those are all things that can increase your risk of cancers. There are other things that we can't control, age, family history. We can't necessarily control those things, but we can control our weight, what we eat, stopping smoking, healthier lifestyles. So we know that there's evidence that it decreases the risk if you do those things: eating healthy, exercising more, looking after yourself. My biggest plug for the bowel cancers is bowel screening. Now, I'm also cluster collaborative lead for our area, so I practice in Splot. What we found across a lot of our ethnic minority communities is that we are not very good at screening as a whole. In particular, bowel screening has been picked up most recently. What's bowel screening? That's essentially you get it a pack through the post once you hit a certain age, so in your 50s, that's right, isn't it? And you'll receive a pack through the post. I'm not sure personally why our uptake is so poor, because you can do it at home, and if you look at this diagram, it's essentially collecting a little bit of the poo and popping it in the sample. Now, you can wear gloves. It's not unhealthy, it's not risky or anything like that. It doesn't involve any blood or anything. It's just a tiny little sample of your poo. I've just included a slide in the middle, maybe some ideas of how you can collect it if you're not sure, and you can collect it in toilet paper. If you want to put cling film down on the toilet seat, collect it in a container. You're just going to throw it away after, but it's just a small amount that's needed. You pop it back in the pack that's provided to you, and you just post it through the letterbox. That's it. It's completely free, and it's offered to everybody. As long as you're registered with a GP in the UK, everybody will be offered it. When bowel cancer is diagnosed at the earliest stage, 9 out of 10 people can survive, but fewer than 2 in 10 people are diagnosed in the earlier stage. So we know if we pick it up early, you're more likely to survive, but unfortunately that's not happening. Some people may wonder, what are we actually looking for in the poo? Essentially, we're looking for blood. So I talked to you earlier about symptoms of blood that you can see, but there's also blood that you can't see in the stools, so that picks that up. The last thing on bowel cancer I'd like to say is, if you're worried and you have those symptoms, don't rely on the screening test. Come and speak to us, your GPs. But equally, please take up the test, because you may not have any other symptoms, and the whole point in the screening is looking for those people that don't have symptoms, because when those symptoms come, often it's too late. So that's why we want to do it. And we know that there's strong evidence that it does save lives. Sorry, we just add it. So even if you saw us, we would do a slightly different type of one called a fit test that looks for blood in the poo. So this is offered over 55 years old, but anybody under that age, please come and speak to us. Even if you've done the screening test and you've got symptoms, don't wait for those results to come back. And if they come back as normal, don't be reassured. Come to speak to us, because it may be that it hasn't picked it up. So if you've got symptoms, come to speak to us. If you don't have symptoms and that test comes through your door, please do the test. So my next topic that I'll be talking about is breast cancer. Yes, yeah. Sorry, yeah, I know the slides are from England. Yeah, it's all across England and Wales, so it's our national screening programme. All of the screening ones that we'll talk about are England and Wales. A couple of them differ in ages, so cervical screening, the age is being changed, but Wales and England do differ in ages, but the screening programme is generally national. It just might be that the age range where it starts and finishes is slightly different. Thank you for that though. So breast cancer, I've just got a couple of slides on breast cancer. So again, like I said at the beginning, what we want to do is break those barriers. We want to improve communication between us within our communities, so we normalise and hopefully people feel comfortable to go and seek help or seek advice when they are worried. So there's 3 bits that I want to talk about. One is, what can breast cancer look and feel like? I think this Know Your Lemons campaign is really, really good, and it's worth accessing and just keeping in mind. So what are we looking for? So things that we worry about, somebody's come to us, but it's not just about what your GP is going to worry about. It's so okay, this is worried. This doesn't look right. If it doesn't feel right, if it doesn't look right, or there's a change, come to see us. So things that may look different, it can feel slightly thickened in one area of the breast. You can get some dimpling in an area. There can be crust around the nipple. It can be red or hot. There can be fluid that's abnormal. So lots of people do have some discharge, or if you're breastfeeding, then but it's different to that, okay? You can have some sores around the skin. It can be more bumpy. There can be some veins that are abnormal for you. The nipples can be sunken inwards, and that can happen gradually, so you may not notice it, but if it's different, it needs to be checked. It may be that there's a new shape or size. Orange peel skin is a big one as well. So literally what the surface, if you imagine smooth skin, but orange peel skin where it's slightly indented all over. So that's orange peel skin. And then the most obvious one is a hard lump. So if you can feel anything like that, then please come and get checked. As GPs, we do these examinations for breasts, rectal examinations, vaginal examinations all day, every day. It's a normal part of what we do. It's not embarrassing for us. It's we need you to come to see us about it. I appreciate it's not the most comfortable types of examinations, but please come to get examined. And if you're not comfortable, tell us that you're not comfortable. Maybe that you may want to see a female GP or a male GP, and if we can do that within our practice, we'll most certainly try to accommodate that. So that's the different things that you're looking for. What can we do ourselves as women, but also maybe our spouses, to think about just remind each other about those regular breast exams. So we should be examining ourselves regularly, ideally after a period, because during period or just before it can be more glandular, so the glands can come up, things can feel a bit different. So if you try and do it once a month after your period, so that will keep your kind of clockwork diary just to keep an eye. So if you know what your breasts feel like, you are more likely to recognise that there's a change to them. So this diagram is just looking at, if you look at the lemon, for example, you may feel a lump, but other things you're feeling for are small lumps, the skin may feel different or thickened. Where are you feeling? You're feeling around the breast area. And I normally divide into quarters. So you feel the 4 quarters, but you also feel going up into the armpit on both sides, okay? So not just the breast area, but also going into the armpit area. So once you turn 50, every female, as long as you're registered with a GP, you'll be invited for screening, which is a mammogram. It's like an X-ray type of machine where they're looking at your breast tissue. Again, it's screening. So if you've got symptoms, go and see a GP. Don't wait for screening. If you've had screening, it's been normal, but you have symptoms, go and see a GP. But please, again, attend for screening. It squeezes like a blood pressure machine squeezes, so it's not painful. It's a little bit uncomfortable, but it's not painful at all. You'll be invited every 3 years for that screening program, and they will just check things over. Again, the uptake isn't very good in our communities, and we really want to push that, because as Dr. Hashim said, his own mother had breast cancer. It's very, very common. It's the most common cancer in females specifically, so it's very common. So we really need to stay on top of things within our communities for this. So you'll receive the letter. You go over to the national screening area. So ours in Cardiff's on Cathedral Road, I think. And you pop in for the appointment. It's very quick. And then they'll send you your results directly to your house. If they want to do any other further tests, they'll write to you and invite you for that. That may not be because they've picked up something that's obviously cancer. It may be that they need to do just a further check on something. Equally, if they've picked up something worrying, then that's great, because at least it's been picked up, and hopefully early detection means that we can do something about it. That's it from me. Thank you.
While they're starting, I'll just introduce myself. So I'm Dr. Qasim. I'm a GP in Newport, one of the founding members of Muslim Doctors Company with Dr. Saima next to me. And I also run a clinic in the hospital called the Rapid Diagnostic Clinic. It's a new clinic that started in the Newport Hospital, and it's to try to find cancer in those patients where the symptoms are not obvious. It's called what we call like a vague symptom clinic. And rather surprisingly, I've been doing it since December. Unsurprising, I'd say. And I've not seen a single ethnic minority, which shows that, you know, we don't go to see the doctor when we've got obvious symptoms of cancer. What's the chances of me seeing them in my clinic where you've got vague symptoms of cancer where it's not obvious? Before I start, I'd just like to ensure that people understand what screening means. Do people know what screening means? Yeah. So when you come to see the doctor, you've got a problem. We do what we call diagnostic tests. We might refer to Dr. Hashim to do radiological tests. Screening tests are for those patients where you don't have symptoms, you're well. But we invite you to come in to have tests, and we categorize you as high risk or low risk. If you're high risk, we're not diagnosing you with cancer. A lot of people are worried about having these screening tests because they think, I might get diagnosed as cancer. But it's to then say, you're high risk,
we need to go and do more, even though you haven't got symptoms, and catch you early rather than wait until those symptoms come. Because for quite a number of cancers, when you get the symptoms, by the time you see us, it can be too late. But so this is why screening is really important. And so for a lot of our community, we're like, well, why should I go every 3 years or every 5 years for a test just to be told I'm normal, you know? But it's important because a lot of these times you won't know that there's a problem until you're much further down the journey. Yeah. So that's why screening is important, and it's different to diagnostic tests. So I'm going to be talking today about prostate and testicular cancer. So first we'll talk about prostate cancer. It's a very common cancer, probably the most commonest cancers in men. And 1 in 6 men will, in their lifetime in this country, be diagnosed with prostate cancer. Very high. And it's commonest in the black community. Obesity and family history can also increase the risks of prostate cancer as well. So it's something that will affect, if not you, people that you know. Yeah, so it's really important. Oops, gone a bit too fast. So what are the symptoms of prostate cancer? Going to pass urine more frequently, or the urge to pass. Normally you feel like you're having a conversation, you feel like you need to go to the toilet, you can hold it. You can hold it for 5-10 minutes, you know. I've drank a lot of water, I can hold it. But suddenly you're like, stop, I need to go. You know, urgency. When you've gone to the toilet and passed urine and you've left, you've got that sensation that you haven't emptied. You might need to go back again. Yeah. Hesitancy means you're standing there and it's wait before you're able to pass urine. You know, there's a delay there. You might find that the stream is not as powerful as it used to be, or you may need to push to start weeing beforehand. And occasionally you may notice blood, or you may have what we call erectile dysfunction. These are more later signs. Something to be aware of with these symptoms can occur in lots of conditions. So I don't want anyone sitting here going, I've got 2 or 3 of these problems and I might have prostate cancer. They occur in lots of other conditions. But it's important that you have these symptoms, you come to see the doctor, because it's not just prostate cancer we'll be checking. We'll be checking, have you got naturally enlarged prostate, something that happens as you get older? Have you got diabetes? Have you got a water infection? And is this prostate cancer? So we're going to check everything. So please don't sit here worrying, I've got at least 3 of them, oh my God, there's something going on. But if you do have 3 of these symptoms, come and see us. Yeah? So just want to show you how the prostate sits. You've got your bladder, and then you've got the tube that comes from the bladder for you to urinate. Imagine a ball of plasticine, and you put a pen through it. That's how the prostate sits around the urine tube. Yeah, it's like a ball around there. And as we get older, the prostate will get bigger as we get older, and that's why as you get older in age, you will start to notice some of these symptoms, and that's a natural process of aging. But with prostate cancer, you'll get enlargements in the prostate due to cancer, which will then also mimic those symptoms. If you come and see the doctor, we'll be checking for other blood tests, check you're not diabetic, check your urine, make sure you haven't got water infection. We will be doing what we call an IPSS score, or what I do is I do an IPSS score, and that's looking at those symptoms that I spoke about on the previous slide. We score you to see how bad your symptoms are. And then we'll do a prostate examination. And this is probably the most embarrassing part for men, is the prostate examination. It is frankly a finger in the back passage. It's not comfortable, but it's not painful. It's quick. We'll be checking to make sure we've got no bowel cancer, low down, but also check your prostate at the same time. We'll be looking to see, is it naturally enlarged? So it looks smooth but a bit bigger, and so you may just need simple medication. Or does it feel lumpy and hard and irregular? And if it does, we'll be concerned that this could be prostate cancer. We then come to the prostate blood test. Now, the sisters to the side of me have been talking about screening, and you don't get called for prostate blood screening. even though it's a simple test and it's extremely cheap compared to the cervical cancer program and the breast cancer program, it is very cheap. And there's a reason for that. If you're negative on the prostate blood test, you're pretty much 80 to 90% sure you don't have prostate cancer. Yeah? Good test. But if it's positive, it doesn't mean anything. It's positive in lots of lots of things. It's positive naturally enlarged, positive in prostate cancer, positive in a prostate infection, positive in a water infection, positive after sex, positive after cycling, positive after dehydration. So it doesn't help us. And that's why we don't give a national screening blood test for you. We don't say, you've hit 50, come and have a blood test. We tell you, if you've got symptoms of prostate cancer, come and see us. Yeah? And therefore, referring you on will be based not only on a blood test, it will be based on the examination findings, what your symptoms are, and what the prostate blood test is. Yeah? And then we'll make that decision as clinicians to see whether we need to refer you on. So the take home is think about those symptoms. If you've got them, it could be prostate cancer, but it could be other things as well. We need to investigate you, simple blood test, and a straightforward examination. Okay. The final thing I want to talk about is testicular cancer. It's not the commonest form of cancer. I read it's about 1%. But it's the commonest form of cancer in men aged 15 to 49. It's a young man's cancer, this is. If you've had a history of undescended testes, you've got increased risk of testicular cancer by at least 3 times. If your father's had testicular cancer, your chance of having testicular cancer increases by 4 times compared to someone whose father hasn't had it. And if you've had a brother who's had testicular cancer, it increases by 8 times. Okay. Sorry, need to speak louder. Just quickly though, a lot of the commonest things that males come to me for is they think that in the scrotum there's just a testicle. But there's actually other things there. And there's other reasons for why you can have swelling or lumps in the scrotum. So if you do have any lumps or scrotum, it's really important that you come to see the doctor. But obviously the most commonest symptom for testicular cancer is a painless lump. Painless lump, no pain, when you're feeling down below. And you might find that the testicle feels firmer or maybe have a change in texture in the testicle. Or its appearance may appear different. You may have an ache down below in the scrotum or a heaviness. But what I tend to tell males is, if you're feeling your prostate, I'm going to try and hold my mic at the same time, and I want everyone to do this. So just make a fist, everyone. Make a fist. And so if you rub this part, and now if you go over your knuckles, it's hard, it's lumpy, it doesn't move. It's stuck to the testicle, isn't it? Yeah? That's the kind of irregular nodule type feeling that you're trying to feel on the testicle. Yeah? And if, yeah?
Stop you there a second. Just for the females, mums, daughters, sisters, you know, just so you're aware, you know, I've got a son. I'd like my son to be able to come to me and say, "Oh, mummy, I don't know what this is." When he's 9, I want him to come to me when he's 30 or 35, when he's got his own children, inshallah. So even for the other side of the room, please note that as well. I know you didn't ask them to do that, but please note that as well.
So that's a simple thing that I'll tell the young males or even older males who come to see me. Because a lot of times they're coming and it's a good opportunity to teach them how to examine themselves, because it may not be cancer that they're feeling, but in the future it could be, and it's really important. So in terms of self-examination, you can check online, but rather than me tell you go online and check how to do it, it's important that we actually tell you how to examine yourselves. So hold each testicle first with both hands and roll with your thumb and finger, and you're trying to feel that nodular irregularity over the actual, what I term the ball, okay? And you're feeling for lumps. And if you come and see us for that, I personally am going to refer you on for an ultrasound scan. If I think it's testicular cancer, it's coming from the testicle, I will refer you to the specialist. But if I feel it's a lump elsewhere, I'll still refer you for an ultrasound scan, which is just a simple jelly scan over the scrotum. It's not painful at all. Unfortunately, there's no screening test for testicular cancer. You know, we don't offer men ultrasound scans, do we, regularly to come. But it's a very straightforward investigation. The ultrasound scan is the same scan as the pregnant ladies have on their belly to have a look at the baby. So that's my presentation. If anyone's got any questions.
Okay, so I mean, I've got two questions here from the lady side, and one of them is, why does being overweight increase the levels of estrogen? Because I said that increased levels of estrogen increases the risk of having womb cancer or endometrial cancer. And the main reason for that being is that estrogen is produced in lots of different places in our body. But one of the main sites of it, other than your ovaries, is the fat cells in our body. So the fat layer of our body. So the more fat we have, the more estrogen we produce. The more estrogen we produce, the higher the risk factor for certain types of female cancers, and in this case, endometrial cancer. So that, I hope that explains why it's really important to maintain a healthy weight according to your height and your weight, and make sure that your BMI is what it should be. It's easier said than done. I appreciate that, but at the same time, small changes can make a big difference to our overall health in females and reduce the risk of getting endometrial cancer. So the next question I had is, what is menopause? So menopause essentially is when a woman's menstrual cycle stops. That can occur at various stages in life. Generally is between the ages of 45 and 55, somewhere around there. And it can depend on a lot of different factors. But mainly depends on your own genetics. If your mum and your grandmother stopped at a certain age, the chances are that you're more likely to stop your periods around that age. But the official definition of menopause is a stop in your periods for at least a year. So if you haven't had a period in at least a year, you have now gone through the menopause. And then if after that year you then start to notice that you have started to bleed, or even if you've had tiny droplets of blood, please, it doesn't have to be a big bleed, it doesn't have to be like a period. Even if you've noticed anything, even if it's on wiping, a small spot of blood on your underwear, anything that happens after the menopause, please speak to your GP. They are the best people who will guide you forward in this. Okay. Is there any other questions? Simon's got two questions. Yeah?
Both do these. So one was, how do you stop discharge that smells bad? Number one point is, no discharge smells perfect. It may smell bad to you, it doesn't mean that it's definitely abnormal. That's the first point. The second point is, if there's a change in your discharge and it now smells bad, or it smells different, that's usually an indicator that you may need to get checked. For example, there are some certain infections like bacterial vaginosis that may smell more fishy. So different to what your normal is. I think it's really important just to take away that I think social media, general ideas of what life is like, you know, everyone should have perfect skin, look perfect, you know, in certain different areas. This is included in that. I would say that I don't think there's a way just to say, how do you make it smell better? If it smells different, or something's changed, or you are worried, then just seek help. It could be a sign of dehydration. It could be that maybe your sugars are high and you need to get diabetic checked. There are different things that could be related. So if you're worried, get it checked. But there's not any specific kind of way that it should smell.
The only thing I was just going to add to this is that vaginal discharge is a normal part of being a female. You know, everybody has vaginal discharge. And like Simon said as well, if you've noticed a change or if you're worried, then that's when the concern is. But if you have discharge, that is a normal part of female anatomy. Okay?
So the last question here was how to differentiate between a normal period and any type of cancer. So for example, if a lady has heavy bleeding usually and pain in her lower tummy, I think I'll do the first part and I'll hand over to you. So if main thing is, again, like the discharges, if your periods have changed, if the characteristics, the nature of your periods have changed, that's when we need to think, okay, why has it changed? If you've always had heavy bleeding and it's always been painful, that's your normal. That doesn't mean that it should stop there and we do nothing about it. There's lots of things that we can do to help, to slow down the bleeding, to help with the pain, but it doesn't mean that you definitely have cancer. It's not one of the big signs that you have cancer if you have heavy painful bleeding or just heavy bleeding or painful bleeding. It's more if the characteristic has changed, that's where we would worry more. But again, if you're struggling with it, please don't struggle with it. There's lots of things that we can do very safely, and it's very common.
And really, Sima's just answered the question for me. So I think, you know, if you have a change in your period, that is there, or you develop like lower abdo pain, lower tummy pain, which you've never had before, that is the time to go and seek help. And like as Sima said, if you've always had it and you're struggling with it, there are lots and lots of avenues for help, and the GP being really the main port of call for that.
There is Know Your Lemons, which is a really big campaign, and there's Cancer Research UK. Those are the two big ones. If there's any general advice, as Dr. Asma said, there's the NHS websites, which are great. We are in the process of developing the NHS Wales app, so it may link into things. But in the meantime, the NHS website and patientinfo.co.uk is a really good one. But if you look on the Cancer Research UK websites, there's lots of really good ones. For the breast one, it's Know Your Lemons. That's it, Know Your Lemons, and it's a campaign.
Well, I'd just say, if you want information, please join our Facebook, Twitter, Instagram. We also have a WhatsApp group as well, where we post regularly, and we can do that today. You can join. We are slowly trying to work our way through information so that we can publish it in various languages, bite-sized, for these types of cancers. And you can also reach out to us on Facebook or WhatsApp and say, I've got this question, do you have any information on this? And if we've got it in our resource bank, we'll post it. If we don't, we'll inshallah hope to try and produce it. But cancer is something that we are working on slowly. It's a big topic, and inshallah we'll be posting information out.
Jazakallah khair, sister. Brother Qasim has really nice suggestion that probably from here until the Isha, probably if we split into two groups, so Sister Sima and Asma will probably join the ladies if they have, you know, kind of considering the nature of the topics, and Brother Qasim and myself will join the men if they have got, you know, kind of question in private. I wanted just to you know, kind of I'm interventional radiologist. I deal with cancer patients all the time, and what I have seen, it is kind of two different approach toward it. There are those people who are you know, overtly worried about the big C. So anything they would think it is a big C, and you will go through their folder and you will find probably tens of scans, and they haven't got a cancer. Okay. And unfortunately, there are the other extremes that the day they come in, it is an advanced cancer. It is a stage 4 cancer. Just I have mentioned my mother's story. And it always, it comes down to what Brother Qasim mentioned, the word embarrassing. Many of these exams, whether it is female cancers or male cancer, the type of the exam is considered embarrassing. And quite often with cross-gender, you know, a lady being seen by a male doctor, or a male patient being seen by a female GP, is considered something really embarrassing. Let me tell you something. That embarrassment won't go away, unfortunately. It only comes at a later stage where actually we can't help you much. Regardless of the type of that embarrassment, it will come anyway if it is a cancer. So we would rather have that embarrassment when we can actually change the direction of that cancer. And I always been asked by my patient, when I know it is a cancer? And I said, well, I don't really know. But there are three things. Remember, cancer is persistent. If you and before going to that, it is across all cancers. If we catch it early, the survival rate is high. We are talking about, for example, breast cancer, almost you cure it. Testicular cancer, you cure it. If it is late, there is no way around it. It's a couple of months, at best years. All of us, we have seen the story of Dame Deborah James. How long did she live? She was a brave woman, and she has done a lot really to raise the concern about colon cancer, and we have seen her story. So please let us keep talking about this topic. It is not embarrassing, and there is no way of kind of putting our heads in the sand and just ignore it. So three things I tell my patient. Cancer will be persistent regardless of what is it. Is bleeding, it is a lump, whatever it is, it won't go away. So this is one. If it is persistent, it needs to be checked. Number two, it is getting worse. It is bleeding, it is lump, it is getting bigger. It won't go away, so get it checked. Number three, there are really, what I have seen with my patients, always they are worried about pain. Unfortunately, most cancer are painless. That lump in the testis is painless. That lump in the breast is painless. But what makes people go to the GP is having the pain. So remember that actually most of these are painless. And don't wait until it is weight loss. Don't wait until it is generalized tenderness. These are really late signs. So I am really grateful for Brother Qasim, Sister Samia, and Aunt Asma for their time. And it was really a great session. I'm going really to close the session now, and we will join you if you have got any kind of question that you want to ask in a private. We will try our best to keep this kind of health awareness educational session here at Dar al-Isra, and I'm just hoping that every Saturday, mashallah, we have this mosque full with people memorizing Quran. I hope people will realize actually they will probably get more ajr saving someone's life as much as memorizing the Quran. I'm mentioning it to my brothers in here because every Saturday there are 30 or 40 of them, and I don't really see as many. Let us remember one thing: وَمَنْ أَحْيَاهَا فَكَأَنَّمَا أَحْيَا النَّاسَ جَمِيعًا. If you help someone save their life, picking up cancer early, you are saving their life. جزاكم الله خير جميعا, and جزاكم الله خير sisters and Brother Qasim for that. جزاكم الله خير. We can distribute these leaflets, and I mean there are some in here if you want to come and pick up some of these leaflets. جزاكم الله خير.